Welcome back to the ACL Academy. So today I'm going to talk about the four prerequisites for ACL surgery. So yes, I'm sure you've heard the saying before, but the better you go into something, the stronger you go into something, the better the outcome is. And that is so true for ACL surgery in itself. So if you got an ACL injury and you're going for ACL reconstruction surgery, it is crucial that your knee looks a certain way going into that surgery because if you do, the better and smoother the outcome, the rehab process would be. We have a lot of data to suggest that if you can get these prerequisites before surgery, that you will have a better outcome than a group of your peers who haven't achieved these prereqs. So I'm going to talk about that in today's video. So let's get right into it. After an injury like this, there are certain things that the knee is going to respond with. We're going to have pain, we're going to have swelling, we're going to have stiffness, and we're going to have weakness. So we have to combat all those, and we need to take some time to work on these things before we go into surgery. So after you get a confirmation of an ACL tear and you're going to have ACL surgery, in most cases, we will push this surgery out anywhere from 6 to 8 weeks or longer so we could work on these things here. Okay, so the first thing that we're going to work on is pain and swelling control. After an injury like this, we're going to be in pain and we're going to have a lot of swelling. Swelling is, or inflammation, another word for swelling, is our body's response to start healing. It's the first stage of the healing process. So our body will send a lot of blood, a lot of nutrients to that knee joint, and sometimes it could pool there. So we need to take care of that. How do we take care of that? Well, we stress the knee less, meaning we get off our feet, we get the leg elevated, and we get it compressed. The faster we take care of that swelling, the better we can achieve the next steps. So the first prereq is take care of that swelling, get that fluid out of the knee. Secondly, most important is range of motion, and particularly we want to get that straightening back all the way. So that's the extension range. Now, extension, when we get the knee all the way straight, that's called 0 degrees. Some of you have a little bit more than 0 degrees. You can get into what we call hyperextension. So you're a little bit more flexible. If that's you, you need to get that injured leg to be hyper flexible just like the other side. So if it's 0, then you match it. If it's more than 0, you need to work on that. And that's done with a lot of stretching, and also using our muscles to keep that active motion. So that's the second phase. So swelling control is number one, and second is getting that extension motion back, that straightening. Third is getting that bending or that flexion motion back. Okay, again, after an injury like this, we're going to get stiff. So it's important that we get the knee moving. The third piece, right, is getting that quad muscle. So that quadriceps muscle, that front thigh muscle, goes all the way from the top of the hip to just below the knee there. And that is the main stabilizer of the knee joint. That is the most important muscle when it comes to knee health. And what happens after a knee injury like this is that muscle will go on vacation and will shut down a little bit. So it's our job to get strength back. So we take some time to work on that as well. And if we can get the quad strength to be at least 80% of the other leg, okay, so different side to side, again, it's shown to be beneficial for outcomes after surgery. So those are the main prerequisites, the 4 musts, okay, before going in for ACL surgery. So if you had an ACL injury, you scheduled your ACL surgery out 2 to 3 months, you're going to rehab, the 4 prereqs you're looking for is no swelling in the knee joint. Number 2, full knee range of motion. So that is the same amount of extension or straightening and the same amount of bending as compared to the other side. And then lastly, your quad strength. So we want your quad strength to be 80% of the other side. If you can obtain these things, if you could take some time and put in some good rehab and get these prereqs, these musts before surgery, your process will be much smoother and you will have a better outcome after surgery. So if you found that helpful, please like the video. Please subscribe to the page. We got some more great content coming out for you.